Hi everybody, this is Renuka here. This is my second video in my series chronicling my fight with depression and chronic pain. Your responses on Facebook, WhatsApp, calls to my first video has been overwhelming. I am very touched. I feel very grateful to have such wonderful people in my life. But even more interesting was to find out how many of you have gone through similar experiences but never could share it or wanted to until now, or that you knew someone who was going through similar difficulties and that they might find this useful. So I am very, very grateful and overwhelmed by these responses. I thought I would do a quick video about how to handle chronic pain, but not in a very larger sense of the issue, mindfulness, long-term planning, but more like quick fixes that I have learned over 8 years now. I was diagnosed with fibromyalgia about 7.5 years ago, but I had been suffering from it even before that. Went through a pregnancy without even knowing I had fibromyalgia. Fibromyalgia is an invisible illness. It is different from chronic fatigue syndrome in a number of ways, but the unifying factor is chronic pain, fatigue, and a number of inflammatory conditions involving various muscles. In the initial days, it was horrible. The only thing that helped me was any pain medication that my doctors would prescribe me, or paracetamol. The pain medications, while they were immensely helpful, they kind of ruined my stomach, leading to even more damaging conditions. So I don't rely on any pain medication anymore, except for the occasional paracetamol. But I have found out a number of things that can help you. If I'm asked, what is the one thing I cannot live without, it would be this: a hot water bag. This probably costs around €2 in any drugstore. This can change your life. When I feel a flare coming up or any part of my body aching, I just fill this up with hot water from the kettle, wrap it up in a nice towel till the heat becomes acceptable, and just place it wherever there's pain. Sometimes, as many sufferers of fibromyalgia or arthritis will know, you just feel cold even in the peak of summer. So I'm always walking around with a blanket or a really thick scarf, and I put the hot water bag or wherever my pain is. At the moment it's in my shoulder blade, and I just wrap the part up with a blanket or a towel to just intensify the heat. Now, please, I'm not a doctor, but I am a lawyer, so I will use sufficient disclaimers. Don't do or try any of these without clearing them with your doctor. I have checked every one of these with my doctor and figured out the configuration for my body and mind. You will have to do that for yourself. Hot water bag. Magnesium oil. This is a godsend, and this was about €1 in a department store. It will probably last for about 3 or 4 months. You just need a few drops, and you have to rub them over any problem area. You can do it up to 3 times a day. Of course, not on any open source. It gives immense relaxation. Of course, it may not always be effective. If the pain is really, really intense, you might need then something that has anti-inflammatory characteristics apart from magnesium. So sometimes you need the big guns. So I use Voltaren gel. It has diclofenac natrium. Don't use this too often. It is possible that you might get used to it and your muscles will not know how to relax without it. So I really only use it when it's extreme or when I'm traveling and I need a quick fix. Of course, it also comes in a spray that could be useful if it's in a problematic area and you're alone a number of, if you're alone a lot, that could be helpful. And of course, you could also take a bath if you were at home, or you could get home, fill your bath with not too hot water because that is not very good, but reasonably warm water and fill it with magnesium crystals. You can buy it in any supermarket, drugstore mostly. This is an own brand, nothing fancy. Just fill your tub with it and lie down. Over time, you will feel relaxation. And I use different kinds of massagers. I have orofacial pain in my jaws, neck and throat. So for that, I use a small massager, which doesn't seem to be working at the moment, and just massage yourself. I have one like that for my foot. Whenever I have pain in my feet after a long day of walking, especially when I'm traveling. And this is a very simple one. This was 30 cents, I think. I got this in India for about 30, 40 rupees a long time ago. And this is particularly helpful for shoulder pain or lower back pain. And it is very handy for when you're traveling. Now, the big guns. This is a Medicana massager. It is a little bit expensive. Everything else that I've shown so far is very inexpensive. You can find own versions in most drugstores for very, very cheap price. But this is about 28 euros. But this is an investment for a very long time. And this is particularly useful for back pain, relaxing your muscles in the back. Normally, I would just rub some magnesium oil and then use the massager. And make sure you are on top of your supplements. I crashed this year because of a very, very bad vitamin deficiency. So get your vitamins and minerals levels checked. And you might need supplements, at least vitamin D, B12, calcium and magnesium. A multivitamin tablet may not be enough if you are suffering from a chronic pain-related disease. But again, clear every single thing with your doctor. Do not do anything without the knowledge or acceptance of your doctor, because that's very important. And one final tip, find a good physiotherapist who understands how the muscles of a fibromyalgia patient are different from a normal, otherwise healthy individual. Because while normal healthy individuals have trigger points where their pain radiates from, we also have tender points. So you have to be careful. It took me a long while to find the right kind of physiotherapist, and I will be speaking a bit more about it later, but these are my quick fixes to deal with my pain on a day-to-day basis, and a lot of them can be put in a travel cabin baggage without much trouble. So I hope this will be of help to you, and I hope to be able to continue this series with you. Thank you. Bye.